Good afternoon, everyone, and welcome to ICoF Childcare Funder webinar. This is Carrie McCann-Botel, President of the Iowa Council of Foundations. Thanks to each of you for joining us today to hear from some of your colleagues about the work they are doing to support childcare needs in their communities and across the entire state of Iowa. We started this conversation at our October quarterly membership meeting, and there was great interest from several ICoF members in continuing this conversation. So that is what brings us all together today. We actually have 25 people registered for the webinar, so really an exciting topic and an issue that's on a lot of people's minds. So glad we could connect to share some information on this important work. During today's call, we will hear from 3 colleagues that will share about information containing their goals for their work in the child care space. Our goals for the webinar today are to help you in identifying leaders in Iowa who are tackling this issue in their communities, for you to learn about research and tools available to help support you in your work, for you to discover strategies that are being implemented in Iowa that may work in your community, and finally to offer you a chance to ask questions of your peers and to share your own ideas about work that's happening in your communities. On our call today, we will hear from Dawn Oliver, Executive Director of the Iowa Women's Foundation. Dawn will share how the Iowa Women's Foundation has prioritized childcare as their focus, provide an overview of the work they have done to date, share examples of how they have worked with Iowa communities in partnership, and finally share resources and supports they have to offer other communities that are just getting started in this work. Next, we'll hear from Kaye Englin, President and CEO of the Community Foundation of Northeast Iowa. Kaye will provide an update from their work that they are helping to lead with the Black Hawk County Child Care Coalition. And finally, we will hear from our partners, the Community Foundation of Greater Dubuque, about work they have been leading in their region on this issue. We will have each of our speakers share their information in successive order, and then at the end I'll open up the line for participants to ask any questions or so you can share about the work happening in your community. I have gone ahead to mute all of the phone lines and will unmute our speakers as we work through the agenda here and unmute everyone at the end. If you do have a question, please identify yourself and your community foundation before you ask that, and feel free to also use the chat box function on the webinar if you'd like to submit any questions during the webinar. So with that, I will get Dawn unmuted here.
Hello.
All right, Dawn.
Excellent.
Yep, I can hear you just fine, so I'll go ahead and turn it over to you.
Excellent. Okay, so you can certainly move off of that picture. Thank you very much. Hi, everyone. As Carrie told you, I am Dawn Oliver Wyand. I am the Executive Director at the Iowa Women's Foundation. And I am really excited to be able to share with you, my colleagues, our work and what we're doing across the state. And really, hopefully, I hope to be able to energize some of you, in addition to the 2 that are already going to be talking today, to get involved and to hopefully help us in your particular communities, because this really is going to be a team effort. Not one organization, not one foundation, not one business can do it on its own. The issue is really big, and it's going to take all of us. So we can move on, Carrie. Carrie asked me first to explain to you how did we prioritize our work and how did we get to where we are today. And to be honest with you, if you would have asked me 3 years ago what I thought our focus would be, I never would have dreamed it's childcare. But because of our research and the community conversations that we held across the state, childcare has become our focus. And it started in 2015 when we learned that 70% of Iowa's female head of households were struggling economically. 40% were living below the federal poverty line, and another 30% are our working poor, or those women who are trying really, really hard to make ends meet, but for one reason or another, they just couldn't. Okay? To us, this was completely unacceptable, and we wanted to know why. And honestly, we wanted to know why, if that why was consistent across the state or if it was the same from community to community. So through our research, we identified 18 communities to visit, and we launched our We Listen and Iowa Wins state tour. And the map you're seeing right now shows you where those 18 communities were that we started with. And when we got to those communities, we asked those at the table, why are women and girls in your community struggling, and what are those barriers that are keeping them from being successful? What we learned from those conversations were that there are 6 barriers to economic success for Iowa's women and girls: employment, childcare, housing, education and training, transportation, and mentors. So once we learned this, we traveled back to those 18 communities that we visited, and we shared with them the data, and we asked them now, in a perfect world, if you can work on one of these barriers, which one would it be and what would you do? So this map now shows you those 18 communities that we visited and the barrier that they chose to work on. And what we learned, again, from these community conversations was that 9 of the 18 communities we visited identified access to affordable, quality childcare as their #1 priority. And because half of the communities identified childcare as this barrier, the Iowa Women's Foundation decided to focus its energy and resources on addressing this issue. We then went back and looked at more research, and what we learned and what we truly believe now is that Iowa is in the middle of an affordable, quality child care crisis, and that this crisis is no longer just a family issue. It is a workforce issue and a business issue and a community issue. I thought I would just share a little data with you that will kind of help you see how we felt we came to that understanding. First of all, in Iowa, 75% of our Iowa households with children under the age of 6 have all parents working outside of the home. We are #1 of all the states, tied with Minnesota and the District of Columbia. To us, that was a big surprise to know that we have that. There are also 529,000 children ages 0 to 12 in the state of Iowa. We have 167,399 child care spaces available. This gives us a shortfall of 361,677 spaces. On average, 1 in 2 children go without access to affordable quality child care. And Iowa has lost 40% of its child care businesses over the past 5 years. We also did the same data for each of the communities that we have visited to see exactly where were the issues. And we found these exact same staggering statistics from community to community. We then took a look at our employment data, because we hear a lot in Iowa about how we have a low workforce and how we need more workers. And we learned that the Midwest is the only region where job openings outnumber job seekers. And today on Indeed.com, there were over 39,000 open jobs listed in the state of Iowa. So after we took a look at this, after what we heard from the communities and we took a look at this additional research, we decided to establish, with our partners across the state, Building Community Child Care Solutions Collaborative. Because this was one of those situations where we knew that this had to be about action, and it had to be actually about getting things done. We couldn't keep talking about it. We couldn't keep looking at the data. We needed to have some action. So we formed, again, this collaborative, and there are 3 goals for the collaborative. And those goals include building a network or a collaborative of communities across the state working together to increase the availability of quality, affordable child care in their area. With this group, we're going to help provide the individuals working in the communities connections and resources they need to create and implement a child care solution, or solutions that they identified to help them increase the availability of quality, affordable child care. And finally, we want to raise awareness among our businesses, community leaders, policymakers, and organizations of each of our community's child care needs and the solutions that they have identified. This next slide I just kind of put in as a kind of some things to tell, a couple of things to show you. How we tried to do this and how we worked with each of the communities was, first, we knew that we couldn't go into the communities. We had community partners. And those community partners really kind of helped us identify who needed to be at the table and who we needed to get there to help us. We then hosted a community informational session with our community partners. And at that session, we presented a toolkit where we provided 6 possible solutions that the communities could look at to increase the availability of child care. Once they identified which solutions they wanted to work on, we then looked at steps that they would need to take next to implement those solutions, who else needed to be at the table, what resources they had within their community already, and what resources were missing, who else they needed to get to help them, and finally, what did they need to do next. So by the time we left each of these community sessions, there had been a framework put around the work that these communities were going to start to look at. Since we held those sessions, we are now doing regularly follow-up meetings. I was doing weekly updates where I was helping trying to share with everybody what they were doing. I think my communities would probably tell you that's too much, and they would like to see it go less. So I think what we're going to do is go to a monthly written update, a quarterly phone call update, and then we are hosting an annual summit where we will bring everybody together to talk about the successes we're having, the struggles that we are facing, and some of the tools and share those. We've also developed and implemented a statewide awareness campaign because it's important, we feel, for everybody to be on the same page with the same message. And so we've been implementing a lot of that. We sent out press releases. We're trying to do lots of social media. We're trying to get our communities to work with us. And finally, in January of this year, we're going to launch our public policy agenda. And we're in the process of working with all of our communities on that. We want to host legislative sessions in each of the communities with the elected officials at the state level, the city level, and the county level to kind of talk to them about funding and what funds we need to be able to implement these solutions across the state. The next slide just basically shows you what some of those solutions were that the communities talked about. Building and expanding child care centers, child care entrepreneurs, that's the workforce that's actually running and operating our child care centers and our in-home. Businesses in child care, community colleges in child care, before and after school programs, child care for second and third shift, and then whatever else. They may have been able to come up with their own solution if they wanted to. So I'm excited to share with you today that we have more than 500 committed volunteers and supporters working together in 19 different Iowa communities to bring real change through our Building Community Child Care Solutions initiative. We already have 3 more communities that have signed up in March, and we are willing to go to any community and work with them and help them as long as there is an understanding that when we leave, the work moving forward has to be done at the community level. It has to be community driven. And I think when you hear from Kaye and Jason, you're going to see how 2 communities took what they learned from those sessions and really moved forward with it. Of course, Jason, you've got your other research, but they're really doing a good job moving their child care work forward now in their local communities. So the next one is a map. I just wanted to kind of show you where all those 19 communities are. This does not include the new ones that'll be added on. They're still working on doing that, so I'll be able to send you an updated one after that. So what are those next steps for the collaborative? What happens if you've got somebody out there or one of your community wants to get involved? We're willing to work with any community and help them look at the solutions, and we'll talk about implementing the solutions. Then we have to share regular updates and our success stories. We're working on, as I said, the statewide awareness campaign and keeping it going, and our public policy. And then, quite honestly, we have to have funding. We know that we can do all this great work, but if we can't find the funding to help these communities implement the solutions they've identified, we're not going to go anywhere. So that's really one of the reasons why I was excited to be able to share this work with you, because you are all local funders that might be able to help the work in your particular community and help us move it forward in one way or another. Okay. Thank you, Carrie. So last but not least, Carrie asked me to kind of share with you what we could do or what could happen if a community wanted to get involved. And so I kind of called this the community call for action. So I ask you all to consider joining the Building Childcare Solutions Collaborative, become another one of these 20-plus communities that we're working with. Help us identify who those community partners could be and host a community session. And then we can all work together to implement the identified solutions. And finally, it's really important that we know that all these communities, I don't want everybody recreating the wheel. We're all trying to work together by sharing best practices and successes, and also sharing kind of those struggles so we can learn from each other and grow. And I say that finally because the Iowa Women's Foundation finally believes that we are stronger together. So that's how we got to where we are on child care, what we're currently doing in our different communities, how we can help a community get started, and I have all kinds of resources that we are in the process of putting together and that we have put together for each of the 6 solutions that the communities have identified to put as far as moving forward.
Great. Thanks so much, Dawn. I do have a couple questions I might ask before we transition over to Kaye. The first is that you mentioned an annual summit. I was wondering if you have an idea of what time of year that will be happening and if you anticipate welcoming other communities into that conversation as a learning opportunity.
Well, we're not there yet. We decided at the end of the year that we wanted to do this. So I have reached out to the partners to say, when is a good time for you? So I'm kind of hearing back, summer isn't a good time, early fall isn't a good time. I'm going to guess that probably not. There won't be a best time for everybody, but we're going to get it on the calendar as soon as possible. And then the parameters around that I will share once we have those set as well.
Great, very good. And then you also mentioned your policy agenda. Is that something you'll be sharing publicly that we could share out with this group so they can become engaged with that as well?
Absolutely. I'm in the process of finalizing the content, and then my board has to approve it at their meeting in January, and then we will be ready to share it with everybody.
Okay, very good. So we'll look forward to getting those updates from you, and I'll promise to share those resources out with this group and also through our other e-communications for the ICoF network. So thanks so much, Dawn. Appreciate it.
Thank you.
All right, now I'm going to unmute Kaye's line. And Kaye, are you there?
I am here. Hi, everyone.
Okay, great. Go ahead and take it from here.
Okay, great. Well, thank you, everyone, for your interest in learning more about some of the child care initiatives that are happening across the state of Iowa. I can just say on behalf of our community foundation, we are really honored and energized, I guess, to be a part of this important work. And in a lot of ways, it's turned out to be a way bigger baby than what we might have thought in the beginning, but yet it's been a great, like I said, organization or great process to be a part of. So I'm going to give you just a brief overview of kind of how our foundation got into this work. we started, when we did our strategic planning a couple years ago, one of the things that we were really looking at is, as an organization that's now 63 years old, I guess, what are some of the things that we really want to strengthen as a regional community foundation? One of those was really leaning towards leadership and how we could become even more engaged in not only our grant making, but our community leadership and our partnership with our nonprofit partners across the state. So one of the things that we've been working on is identifying, kind of putting stakes in the ground for strategic initiatives. So actually, almost, a year and a half ago or so, one of the initiatives that we decided that we really wanted to move forward on was childcare. Again, looking at information within Black Hawk County, where our host foundation is located, that childcare has been such a barrier for employment and so many other aspects of community life. And so that's how we attach to childcare. One of the other initiatives that we're working on that we're finding is so connected to childcare is also workforce readiness. I know you heard Dawn mention that as one of the initiatives that the Iowa Women's Foundation has identified too as a barrier. So our foundation is also in the process of really engaging and launching around workforce readiness, and I'll share just a little bit about that as I'm talking about some of the other ideas. But so we got into this work because of community leadership, and for about a year and a half now, I guess, we've had a local Black Hawk County Coalition, myself and Mary Jansen, who is the director at Early Childhood Iowa Contract, is the other co-chair. And you can see here on the slide, I guess, some of the other individuals that are actively engaged in our work, people that represent Hawkeye Community College, the schools, the YWCA, private business. Senator Danielson is on our steering committee, et cetera. So we've got a really nice group of individuals. We're meeting now on a monthly basis, but we started off with a community meeting, the model that Dawn was just sharing with you. We had great participation, about, I don't know, it seems like it was over 60 people that came in May of 2018. And then we've now hosted a second meeting. We did a business summit that was geared much more towards businesses and how that connects with childcare work. And we kind of got to that point really because we've been working very closely with our local Alliance and Chamber. And our Alliance and Chamber, in collaboration with our Childcare Coalition, has implemented a couple series of surveys to really get at what kind of an issue is the lack of childcare in Black Hawk County, and it's a very big issue. 26% of the businesses that we surveyed were indicating that childcare is preventing them from hiring and or retaining employees because they cannot find quality childcare for their children. So we're very fortunate, I think, in our county in that I feel like when we're meeting with businesses and talking about the demand for childcare and asking them to be a part of a solution, it's not like we're trying to convince them that there's a problem. And I think that is a real benefit for our coalition, in that now we're able to move forward with solutions and we're not trying to convince them that we have a problem. People realize we have a problem. So one of the solutions that we're working on is the business and childcare and building and expanding solution that you'll see. We've got leads for each of those groups, and those involve a member from the Alliance and Chamber being actively engaged as well. And what we're looking at there is how we can expand the opportunities for childcare in our community. And we've been really fortunate. Again, we're short 13,000 slots in our county, which is huge. We have been able to secure and grow, I believe it's six organizations have committed to building or expanding already, which is going to be around 450 slots. So as wonderful as that is, we still are worried about the 12,000 plus kiddos that we don't have adequate child care for. So we have made some really great progress, but yet it's a very, very large issue and hurdle to get over. So we've got a team of people that are working on that right now. What that means is that we're sitting down with a lot of our larger employers, talking with them about the possibility of coming together and forming some larger child care buildings, centers. And again, fortunately, we've got several pretty large employers that are at the table that are willing to put some dollars together to make some of those arrangements and opportunities happen. So a lot more to come on that, but again, I think it's a good match for a community foundation or for an organization that has that development capacity. I mean, I personally love having a conversation with a business partner that might be willing to financially invest in something that's going to do good for their business, their community, the way that people look at them in the community as a leader. And so I feel like, again, it's a good match for a community foundation to kind of be in that position of influencing and also convening and bringing people together. So I really enjoy that. The next one I'll talk just briefly about is our community college partners. That has just been, again, we're so blessed to have Hawkeye Community College that's actively engaged in our work. The University of Northern Iowa has also been coming to the last few meetings, but especially the child care, the community college and the child care initiative has really, what we're looking at there is how we can even change the way that classes are taught to people that want to go into the child care career, whether that's actually forming their own in-home daycare and what it takes to really run that like a business. And what we're finding is that people are getting out of that business because it is so complex and because they don't maybe have the skills and or the desire to have all the management responsibilities of running their own business. And so Hawkeye Community College is creating basically a whole expanded curriculum. We're looking at barriers for people receiving those certifications and how that could be done even in an easier way through online classes, just all kinds of really cool things. So that, again, kudos to them for really working on that process. And then the other part, the other next goal, I guess it's up on the screen now, is the Child Care and Entrepreneurs solution. I'm lead on that one. I'm also working with a couple local businesses, and what we're looking at doing is addressing the barrier of benefits for child care workers. We did a very comprehensive survey to child care providers, both in-home and center-based. Maybe it's been about a year ago, I guess. And what we heard as a major barrier for people staying in the child care business is the lack of affordable benefits. And so what we're potentially doing is putting together a hub of an employment for child care employees. And it would be basically an umbrella type organization, or I guess it's really referred to as an association health plan. And that would be, our goal is that we would start in Black Hawk County offering that benefit package, but our goal would be to open that up and make it a statewide model. So I know that I've got a conference call this week with individuals through the state of Iowa to look at next steps for us forming that association health plan. It looks like right now that will potentially fall under the Community Foundation of Northeast Iowa's umbrella. And so again, that's really exciting and a lot more to come, but it's something that I know a lot of the child care groups across the state of Iowa are really hopeful that we'll be able to accomplish that and that we would be able to open it up to be a statewide association. And then the next one is around our non-English speaking community. We're just extremely blessed in our county to have a great diverse population. Along with that, when you're looking at former refugees and other non-English speaking members of our community, African community, et cetera, there's real complexity around the interpretation and the translation needs. And we hear that all the time from our nonprofit partners as they're working on their grant applications or they're working on, other challenges within their shops. And it's no different with the child care barriers. And then the other thing around the non-English speaking community around interpretation and child care and hiring and retaining individuals from the non-English speaking community is that they have their own cultural barriers too that might prevent them feeling comfortable, again, leaving their child in the care of someone who doesn't have the knowledge of their diverse community, and especially around language and things. So those are just things that we're working on. Our foundation did make some pretty significant grants this fall to Embark, who has really been actively engaged in Black Hawk County, primarily around refugee services, but they're working with Iowa State University to do a pretty comprehensive evaluation of our county to look at the non-English speaking individuals and how barriers are preventing them from child care services and also work ready. So they're in the process of launching those two evaluations right now, and again, our foundation put up the dollars to bring that expansive service into our community so we can really get at some of those barriers and come up with some solutions that are going to help really bring employment opportunities and child care opportunities to that population. We're looking at models along with our employers here locally where we can potentially hire in teams non-English speaking individuals that might have, let's say, for instance, working in some of the cabinetry manufacturing companies here that are pretty prevalent, where they could hire a team of refugees, and along with that, transportation, interpretation, and daycare could potentially all be wrapped up into that service or into a package of employment, and it would be just a win-win for both the employer and for the individual. So those are kind of some maybe out-of-the-box type thinking and strategy that we're working on right now. And then the next page, I think, Carrie, is just a few highlights. Oh, yes. So there's just a list of some of the first successes, I guess, that have come out of our coalition's work. Hawkeye Community College is expanding into their new Metro Center, and Exceptional Persons Incorporated is going to come in and actually manage the daycare side of their work. And that's 56 slots. That's will open up here in a couple of weeks. Friendship Village, which again is a retirement home, and in conversations with them, they decided that they wanted to take the leap of providing daycare for their employees, a priority to their employees, and then next to the community, and they're breaking ground next week on a big facility. Dunkerton, Sacred Heart, Waverly Community, and Hudson are all just some other examples of some expansion that's going on. So again, just some really great things that are happening there. I think those were really my high-level updates. Other than, next steps for our group is sitting down with some pretty big employers here in Black Hawk County that have indicated that they're ready to financially make some investments into expanding childcare. So we just have some really great synergy and enthusiasm, I think, right now as a county, and it has already spread out to some of our affiliate counties that are already asking us, what is it that we can do? And so we're trying to really share that information and encourage our affiliate partners to become engaged in the work as much as they can, as well, because we realize that it's a pretty broad statewide concern at this point.
Great. Thanks so much, Kaye. Really enjoyed hearing about the association health plan. I think that will be something of interest to several communities and employees across the state.
Yes, I think so too. We're hoping that that'll move along a little bit faster this week now that the government's back up and going in Des Moines anyway.
Yes, absolutely. Great. Thanks so much.
You bet.
And next, I'm going to unmute Jason Neises' line. Jason, are you there?
I am. Can you hear me?
Okay. Yes, I'll go ahead and turn it over to you, Jason.
All right. Thanks, Carrie. Well, good afternoon, everyone. So my name is Jason Neises, and I do community development work here at the Community Foundation of Greater Dubuque. One of the things that we've been working on throughout our region is access to quality, affordable child care for everyone in our region. So for us, we've been approaching it from a workforce standpoint, of course, as a way to get more people into the workforce with our historically low unemployment rates, but also as an equity issue. We know that access to quality child care is often least available to the people who need it the most. So how are we addressing those issues, not just in our urban areas like Dubuque, but also in our rural areas? So as Dawn mentioned in her presentation, we did start off with research. So we did some research here in Metro Dubuque through our Project Hope process. We did a child care needs assessment. We also then did some stakeholder research with parents, child care providers, agencies, educators, employers in our rural regions as well. Actually going out and doing focus groups and community engagement activities in our rural communities as well to understand the landscape. And quickly what we found out was that there was no single solution that was going to address issues in all of our areas at once. So we really have had to be adaptable and understand that in some places the issue is going to be access to child care. There aren't enough slots. In some areas it's going to be affordability. So we need to be sure that we're nimble enough to be able to find solutions that fit each one of those communities the best. And so so we're developing a network of stakeholders that we're going to keep affiliated through a coalition we're still forming. Our friends in Blackhawk County have been very helpful. Mary Jansen and I have spoken about their coalition that you just heard about from Kaye. So it's been very inspiring to us to think about how we can form our own coalitions here, especially ones that keep our business community engaged. So that's kind of some of the research that we've done in Dubuque and in the rural areas. We also had we were fortunate enough to have a group of graduate students from MIT who came to our region and stayed here for 2 weeks and did research largely with employers to provide some localized research about what would work for local employers to provide their employees with better access and to reduce their recruitment and retention costs as employers. So armed with that research, we recently convened in the fall. We convened a solution summit. Dawn was there, and we really tried to figure out how are we going to get the right people around the table and what actions make sense. So several things have come out of this research in the Solution Summit, one being a program that's being spearheaded by the Greater Dubuque Development Corporation, which is our local economic development group, and Northeast Iowa Community College. It's called Opportunity Dubuque, and this is an existing program that provides job training for underskilled and underemployed adults. And what they found in that program, which has existed for 5 years, was that most of the participants were men, and very few of them are women. And one of the barriers to participating in this training program was access to childcare. So we are developing a program where all participants in the program will have access to childcare during the training program. So that's a big step forward as far as like getting different kinds of people into the workforce. The other part of the change to the Opportunity Dubuque program is going to be that we will be also, instead of just training people to be CNC operators or welders and those sorts of things, there will be a childcare track. So people who want to improve their skills and improve their employability in the childcare field can get a certificate through this NICC and GDDC program called Opportunity Dubuque that would make them more employable as a childcare worker. There will also be a track for people who want to start their own childcare business, which we also see as an important part of this mix, is to increase the number of in-home providers in our area, especially in our rural areas where in-home care is often more nimble and flexible and adaptable to the needs of smaller communities. So we're very excited by that program. Not only will they receive childcare while they're in the program, it will also provide childcare once they're employed in their field for 1 year to help them get on their feet and hopefully mitigate some of the challenges they might have bumping up against the cliff effect and things like that and making themselves unemployable because they can't afford to work. So by taking out that childcare variable, we're hoping to really get these people employed and get them up to speed much more quickly. So that's been a great collaboration between Greater Dubuque Development Corporation and Northeast Iowa Community College. They set the curriculum. They did a lot of the research for that, partnering with our local child care resource and referral staff here. It's been a really cool collaboration to see that happen. Through our research, we also met lots of different employers who are bumping up against problems, finding trained staff or employees who can fit their hours, who can afford the child care while they're at work. So we're getting an increasing number of employers who are interested in looking at solutions for their staff, for their employees. So we've come up with several different ways to engage those folks. One being that there are several people who are interested in having on-site child care, but they're quote-unquote not in the child care business. You know, those of us doing this work have heard that over and over again. I'd like to do something, but I'm not a child care provider. I don't know how to do it. So we're looking for solutions to help out with that, including looking at cooperative models where several different companies could go in together to operate a child care center in an industrial park or someplace like that where not one individual company would have the risk of operating the child care center on their own. We're also looking at options where companies could outsource that child care provision to a private company like Bright Horizons. So we've had several very productive calls with employers and Bright Horizons to get them into a business relationship that will be profitable for both of them and at the same time increase access to quality child care in our community. We're also then, so aside from actually getting, and so there's several of those conversations happening right now, and we're very excited about the potential for those. We're also very hopeful that, again, based upon the model we have in Black Hawk County, that we can get a coalition of business leaders together who would meet regularly and find support among their peer network to get more of these kinds of creative solutions in place to help our businesses find like-minded partners who would collaborate on this. We're very excited about the prospects for that. We also are very much focused on advocacy and how are we getting the right people around the table, not just decision makers like legislators and those sorts of folks, although we are working with them, but also just people in the general public to raise awareness about the importance of child care as a quality of life indicator, and whether or not you have children or not, you should care about child care. And really raising that up as an infrastructure issue in our community, I think, is going to be key if we're ever going to make headway with decision makers to allocate more municipal funds or state funds or federal funds that might further expand the access for for marginalized audiences, we need to have better infrastructure for childcare that might need larger infusions of money than we can currently get at the local level. So a broader public relations campaign to help get all citizens of our community to understand the importance of childcare and why larger investments by the community may be necessary for us to reach some of our goals for access and affordability. So I think that's got me very excited as well. Like, how are we doing that and how are we engaging people in that? We've had very receptive audiences among our elected officials, so I've got great hope that we'll that conversation is going to expand in the next coming months, especially during the next legislative session here in Iowa. That kind of hits some of the high points for what we're doing here locally. We've still got a lot of work to do, and it's very inspiring to hear the work that's being done by the Northeast Iowa Foundation and the work that Dawn's doing all across the state. So thanks, everybody.
Great. Thanks, Jason. And the Community Foundation of Greater Dubuque shared several resources from their research and the summit that they hosted at our October membership meeting. So I will include those documents with the other meeting resources from today and get those out to everyone on the webinar in a follow-up email. So you can look forward to receiving that later this week. I'll go ahead and unmute all of the lines. You, of course, can still keep your line muted if you would like to, and open it up for questions.
The conference has been unmuted.
Oh.
Okay, I'm doing it tomorrow, but
So,
2 minutes is going to be, no, everybody was like, oh, okay, like,
we'll see how this goes.
Well, Abby
Feel free to chime in if you have a question for one of our speakers.
Some guys did too. But I think anybody on Friday. But after tomorrow, I think 3, 4, 5 minutes is going to, I mean.
Okay, I'm not hearing any questions. Feel free to send any follow-up questions either to me or directly to one of our speakers. I'll include contact information in that follow-up email that I mentioned. Of course, we are interested in hearing from folks today if this webinar was helpful as you think about your work in your communities, and also what information you would like to continue gathering as you think about this work. If there's any specific speakers that you'd like to hear from, if there's any research or tools that we can be helpful in identifying and sharing with you, either in a webinar format or a different learning format, we're happy to continue supporting these conversations for funders across the state, as it is clear there is a need for these conversations and funders are ready to engage, as well as several community partners. So with that, I'd like to thank our speakers today, Dawn, Kaye, and Jason, for sharing your great information with us. Please contact me if there's any specific questions or follow-up items related to this topic. We do have 2 additional webinars happening next week. The first is on January 15th at 2 p.m., and it will be focused on Census 2020 outreach and engagement. So hope you can join us for that. Again, a very important issue for all communities in Iowa and one that all different types of funders can engage on. The second webinar has been designed specifically for community foundations, and that will be January 17th at 2 p.m. with Adam Northup of Locus Impact Investing, talking about the roles that community foundations can play in the Opportunity Zones provision and making that come to life in their communities. So I will share registration links for those 2 webinars in my follow-up email, along with the webinar recording and slides from today. Thanks again for joining us, and I hope everyone has a great afternoon. Take care.
Thanks, Carrie.
thank you.